Hello, everybody, and welcome to The Better Life with Dr. Pinkston. I'm Dr. Marianne Pinkston, and bringing you some information that is cutting edge and definitely looking at some problems that I think are not only known to South Texas, but nationwide. And one of these topics is fatty liver. And we've talked about it before, but today I'm going to bring you Dr. Carlos Duncker, who is with Pinnacle Research. And he is head of strategic partnerships in Pinnacle for getting the word out on this very important topic, fatty liver. And welcome in, Dr. Duncker. I have you here, and I want to go over your CV a little bit, but it is extraordinary and long. You have an enormous amount of expertise in nuclear medicine and in research. And I know fatty liver is something that is near and dear to your heart, working with Pinnacle now. So tell everybody a little bit about you and how you came to be so interested in this topic.
Thank you for having me. Yeah, for sure. So I started my career in the late 80s when I graduated as a physician in Mexico, in Ciudad Juarez. Then I moved to Spain, and that was a life-changing experience for me. I started experiencing what research is, what it means. I got a PhD and my specialty in internal medicine and nuclear medicine. Then I was invited to participate with the Johns Hopkins. I moved to Baltimore for a year, doing even more research, and then back to Mexico, where I was head of the nuclear medicine department at the National Institute of Cardiology, and then for 17 years at the Children's Hospital of Mexico, doing research all this time, plus all of the clinical services that a common clinician has to do. After that, I kind of retired, you could say, in 11 years ago, and I moved to the United States. After 2 years of a sabbatical, for the first time in my life, 2 years without a real job, I used this time to hone into two of my very, very serious hobbies. One is cooking, and the other one is photography. So after these 2 years, I said, I cannot keep doing this for the rest of my life. So I
Once
joined
a clinician, always a clinician.
Exactly. I joined a group in Dallas, Texas, Texas Digestive Disease Consultants, which is now part of the GI Alliance, the largest GI group in the United States and the world, probably. And I was managing the group of coordinators and the staff that was involved into doing liver research. So I spent with them almost 4 years. And at some point of doing some great things there, I was hired by this company out of Oxford in the UK to be global director of medical affairs. I spent with them shy of 5 years promoting some medical devices for the diagnosis of liver diseases, and mostly on the diagnosis of fatty liver disease. So with this almost 10 years of honing my expertise on fatty liver disease, I was invited to participate and work with Pinnacle Research. So this is why I am here. And my job really is pretty much about educating, if not the public directly, maybe institutions, large clinic groups, on the importance of diagnosing, detecting the disease. Because as we will probably say in a few minutes, there are millions of people that have this liver disease that can be serious and that are not diagnosed. Right. People that are still going on Saturday to the happy hour, right? And drinking some alcohol, completely unaware that they may have some serious liver disease already.
Absolutely. And the reason this is near and dear to my heart is because I do have a history of fatty liver with excess weight and obesity that I had in the past. Was able to lose weight and get these things under control. But what it did was, as a physician, open my eyes to the fact that this is a huge, an enormous problem that is very underdiagnosed. I think from a clinical perspective, physicians do not understand and realize the enormity of this situation, but patients do not understand the enormity of this situation as a disease that you don't feel, you don't know is occurring, underdiagnosed, undertreated. We need to alert the masses that this is a growing worldwide, not just South Texas. We focus a lot on this in South Texas, but not just a South Texas or Texas problem, Southern United States, a worldwide problem. And so your involvement is interesting from a nuclear medicine and cardiology perspective now into liver disease. A very, very unique tie. And you bring a lot of great work in for Pinnacle now. Great. You guys have been a sponsor of mine for a couple of years now, but I don't think that even in South Texas we understand the gem that we have with Pinnacle, and the fact that people like Dr. Stephen Harrison, Dr. Rashmi Patil, there many different physicians there, I can name them all, that are involved in worldwide research of fatty liver and just how in depth this problem goes. How do we change the view of of fatty liver now? Where how do we make people understand how significant this issue is?
Yeah, that's a very, very good question. So I think that this needs to happen from different perspectives all at the same time. Mm-hmm. The public needs to be aware. That's one. Physicians need to be aware. That's the other. And institutions and healthcare systems also need to be aware. One of the main problems about this is not that doctors don't know about the disease. The main problem is that there is no treatment available approved by the FDA yet for this disease. Right. Therefore, the only option today for people that are diagnosed, the small percentage of people that are actually diagnosed, is to recommend some lifestyle modification and some changes in diet, nutrition, exercise, and so on. And that actually works. However, we know that the problem of overweight and obesity in the United States is a huge problem, and it's not easy. Only about 10% of those people that really need to lose weight, maybe because of fatty liver, maybe because of type 2 diabetes, maybe because of cardiovascular risk factors, all of those people are unsuccessful. 90% cannot do it. And those that actually do it, they regain the weight when they stop following the indications. You lose the weight, you get happy, you start eating, and suddenly you are back to the same weight that you had before. So that's a huge problem. And the physicians get tired. I'm sorry to say it like this, but it is true. They get tired of seeing the same patient over and over throughout the years or throughout the months. Coming back with even a few pounds more than they had in the last visit. So you cannot spend 30 minutes because of the amount of patients that you have to see every day. You cannot spend 30 minutes with every patient to tell them the same and the same. You get burnout as a doctor doing this. We have now some medications for weight loss. I was just looking in the news, Weight Watchers, for example, saying that the age of diet and all these products for losing weight may be over with the coming of these drugs that actually make you lose weight. The problem with those drugs is that, they work. However, when you stop taking them, then if you don't do your lifestyle modification, if you don't change your diet, your nutrition, then you stop taking the drug and your weight will come up right there. Right. And will again be obese and again have all those risk factors that you have been working so hard to get rid of.
This is true. You just described everything that has ever passed through my mind about, first of all, being a clinician and discussing with patients the fact that over and over, you're right, 20 patients a day, 20 times a day, I have 10 or 15 minutes to do this with people, to describe for them the fact that their diet, their lifestyle is what is ultimately killing them. They feel fine now. They just went out this weekend and ate large, dinner at the local restaurant, drank their alcohol, took their Tylenol for their, maybe a little hangover the next morning. These things are affecting not only their liver, but their cardiovascular system, their risk of diabetes later on, the risk of dementia, inflammation. It's a snowball that rolls downhill. And there's no way to get across to people how much they need to do for themselves to change. We have a mentality here in the States of give me the medication and I'll fix it, and that will fix it. And then I can continue to live my life the way I want to. And heal myself. And this is something that is not successful. We've shown this for decades now. The pharmaceutical industry is failing with it. We are failing with it as clinicians to try to get this across to people. The food industry has taken us over. We are, we are stuck. And I'm just not sure, I'm with you, I'm not sure how we can ever, from a different perspective, attack this. And going back to liver disease, then, they hear about the number one killer of, Americans, heart disease. They hear about the number 2 and 3 killers, of cancer. Why is fatty liver disease important? We've got heart disease to worry about. We've got cancer to worry about. So why is liver disease important? People need to understand this is largely important. How do we bring fatty liver up to the level that we have with cancer and heart disease?
That is incredibly important, because actually the name of fatty liver disease was just changed at the beginning of this year. Mm-hmm. And now the name is metabolic dysfunction associated steatohepatitis, or MASH. Right. So this is the new name for fatty liver. And what it actually tells us is that fatty liver is associated to multi-organ diseases, so to other things beyond the liver. And this may be a higher risk for cardiovascular events, stroke or a heart attack, also for dementia, as you just said, Alzheimer's disease. These people live in a pro-inflammatory state that also facilitates some oncologic disease, some types of cancer to appear somewhere in the body. This disease is also associated to insulin resistance, yes, which will end up in the patient having type 2 diabetes. These people have usually hypertension, dyslipidemia, high cholesterol, and so on. So fatty liver is incredibly important, because by treating first of all, diagnosing fatty liver, it has a lot of prognostic implications. This means that if we have a patient in front of us and the patient has fatty liver, mm-hmm, especially when this fatty liver is associated to inflammation and the production of fibrosis, which may lead to cirrhosis of the liver, right, even when these patients don't drink any alcohol, they will at some point, they may be in front of the same problems and outcomes that a patient that drinks a bottle of vodka every day, right? So we diagnose these people. That's step number one. That's incredibly important. Once we diagnose them, we have to assess how far into the disease they are. So is it just some increase of fat in the liver and that's it? Or does this patient also has a lot of inflammation going on that liver? Okay. And if there is inflammation, does this patient have some degree of fibrosis or not yet? It is frequent that we diagnose people already with cirrhosis of the liver that are not aware, not even that they have any problem with their livers going on. And when we do that, that's too late, right? So I think that diagnosing fatty liver it's like a window to the rest of the body.
It is.
To the rest of the organism.
Absolutely.
We detect a patient, we diagnose the disease, we see how advanced it is, and then we can tell if these people are at risk of other outcomes, such as oncological cancer outcomes, cardiovascular disease, and so on. So it's incredibly important, fatty liver.
Absolutely. I see this as a kind of I try to explain to patients the big picture view. You know, I know you're here to go over your labs. And we're going to talk about your cholesterol, and I'm going to refill your medicine, and you're out the door. But what I really want to get across to you is that it is not just your elevated cholesterol. It's not just your blood pressure. It's not just your sugar. I'm looking at you, and I see a person with increased abdominal girth, a little bit overweight. Some people, you know, very overweight. But I'm looking at you as a whole picture. You have metabolic inflammation. It is affecting every single organ of your body. And, you know, today we may be focusing on your cholesterol or blood pressure or, you know, your blood sugars, but all of this is affecting you as a whole being. Your liver is a part of that organ system and ignored because it's not, you know, there's not a big fancy pharmaceutical medicine and commercial we can put out about, you know, your liver, but this is an organ that is at the basis of cleaning out and organizing your body from a lot of this inflammation. And once it's affected, then the rest of your body, from the heart to the brain to, you know, the cells for cancer, whatnot, are being affected well. It's a whole piece. And so if we can, as physicians, I guess, begin to pick apart patients to help them understand that it's a whole metabolic unit, you know, that every organ is involved and every organ is important, then maybe we can begin to make a dent in why things like lifestyle and whatnot are so important. Like I told you in the very beginning, this goes very, very fast. We're already butting up against a minute left here. And I want for people to understand that getting this diagnosis is a piece of the puzzle. It's just as important as getting your stress test. It's just as important as getting your blood sugar checked and your blood pressure checked. So what you guys have been great about, and I've advertised now for the past 2 years, is to go online to pinnacleresearch.com and get yourself scheduled for a FibroScan. FibroScan is a very easy tool. It's a very simple. I went and did it. It's a 7-minute. You know, I was there for 10 minutes maybe. Great staff. Everybody got me in and out. I was able to walk in, get the FibroScan done. I spoke to a provider on my results, was able to know that after all my years of weight and whatnot, that I had, changed my my course and that my results were improved. But we want you to go to pinnacleresearch.com, get scheduled for that FibroScan, and take a look. And this will put you together to, metabolically, so that you can understand all the pieces of the puzzle. Dr. Duncker, give me a moment. We're going to take a short break here and come back on the other side and talk a few more minutes about this important disease.
Fatty liver is linked to 2 different situations, alcohol and diabetes or obesity. In both cases, patients can have no symptoms. In the United States, and in particular, Texas, the most common cause of liver disease in general is non-alcoholic fatty liver. Again, associated with overweight, obesity, and or diabetes. Additional risk factors include high cholesterol, high blood pressure, Hispanic ethnicity, and postmenopausal status. At Pinnacle Clinical Research, we offer a quick, non-invasive ultrasound-based screening assessment called FibroScan. This test is done at no cost to you, and we do not take insurance. The test will measure the fat and stiffness in your liver and stage your risk and development of fatty liver disease. You will meet with a provider immediately following your scan to go over your results. If you're interested in getting more information on your liver health, please call 210-529-7978 and schedule your FibroScan today. We are conveniently located in the Medical Center at 5109 Medical Drive.
Welcome back, everybody. I'm Dr. Marianne Pinkston here with Dr. Carlos Duncker from Pinnacle Research, who we have had a great discussion about metabolic disease and how it affects the entire body, but mainly the liver. Pinnacle Research is in liver research. We have been talking about fatty liver. Since you are part of a research corporation, and tell us what research is out there. What can people do? We know the enormity of the problem now. What are we going to do about this?
Well, there is a lot being done. At Pinnacle Research and down in the valley known as STRI, South Texas Research Institute.
Yes.
We are probably the network that is the most involved in fatty liver clinical research in the US. And we have many sites throughout Texas. What we do is we work with pharmaceutical companies, important pharma companies that have drugs that potentially can benefit and cure some of the waterfall of things happening in a patient with fatty liver disease. Mm-hmm. Some drugs, for example, may be focused on destroying or dissolving all this fibrotic tissue that has already been produced on some patients. Some other drugs may try to stop further production of this fibrotic tissue. Some other drugs may be aimed to reduce the inflammation in the liver. Some others may be focused on to decreasing the amount of fat in the liver. That is the trigger of all of these things happening. So there's a lot going on. And many medications actually work at different levels. Right. They may reduce the fat in the liver and the inflammation and the production of more fibrotic tissue and so on. So with that said, the most important thing for people that have risk factors for fatty liver disease will be to check themselves, right? Just check me, please check me and let me know if I have fatty liver disease or not. Right. What are these risk factors? So who should be worried about the possibility of having fatty liver disease? Well, this is mainly those people that have some sort of overweight or obesity, people that have been told that have a fatty liver, people that have elevated liver enzymes. You go to your doctor and, man, this is so common, right? The doctor will tell you, oh, your ALT, your AST, they are commonly known as LFTs. Your LFTs are elevated. And then there is nothing to do about it. So the doctor will just suggest that you lose some weight and that's it. But we need to do something else, something beyond that, because the clinic is not enough to diagnose the patients with fatty liver, nor to tell you how severe the fatty liver might be on that particular patient. So what we do at Pinnacle and STRI is that all these people with potential risk factors, we welcome them. We do a fibroscan. A fibroscan is nothing else. You can think of it as an ultrasound medical device, just like an abdominal ultrasound. There's no pain, as you just said. It takes 7 minutes to complete, and that's it. And with that, we can tell if there is evidence of increased fat in the liver. That's very important. And the other one, we can tell if there is evidence that the patient might have some fibrosis already going on in that liver. If you have this, then at these clinical research sites, what we will do is to invite you to participate in some of these clinical research trials that we have going on. And what people get out of this that is potentially beneficial is that they have early access to potential medications that are not in the market yet, but have already been assessed for safety and all of that.
Yes,
we focus mostly on phase 2 and 3 clinical trials, which means that these are drugs that are already heading to aiming to get approved by the FDA. And for that, it's important to prove to the FDA that these patients taking the drug got some benefit out of it, that the liver disease improved. And then with that, we can, these pharma companies can run all this information and statistical analysis and so on through the FDA to see if the drug gets approved or not to be on the market.
So,
As a very important thing, I can tell you that with the prevalence of this disease, we expect that probably 120 million people in the US have fatty liver disease, and there is no one drug that has been approved yet for fatty liver disease by the FDA.
That's right. That's amazing. 120 million, not one drug out there. We have our statins, we have our blood pressure medicine, we have our diabetes medicine, nothing for fatty liver yet. So it's, I think patients in our last minute here, and our patients, when they hear research, I think feel fearful that this may not be something quite safe yet. I don't want to take chances with my life. You are not doing that. These are drugs that are already been through those through those studies. We know that they're safe. Now we just need to find the clinical applications of it. When you participate in this, you're right, they have early access to these medications, but also have the potential to put their name in the hat of being someone who was on the forefront of saving somebody else's life down the road. It's a wonderful opportunity. Research should not be something that people are fearful of. And so Pinnacle, I think people maybe have not heard a lot about Pinnacle or STRI, but the South Texas Research Institute. But this is a very, very wonderful company that is on the forefront of changing lives for fatty liver. And I'm so proud you guys are doing it. I'm proud to be associated with you. I want people to know they can go to pinnacleresearch.com and get signed up and get that fatty, that fibro scan. Get seen, make sure that you are not in those stages of developing fatty liver. And we're going to have another show coming up where we talk a lot more about this. I am so thankful to have had you on today. Dr. Duncker, thank you so much. We've got a lot to talk about, so we're gonna have another show where we do this. And if everybody will go to drpbetterlife.com, there's information there on our previous shows, Dr. Harrison, Dr. Patillo. And also look at Pinnacle and have a link to go and sign up for that FibroScan, but pinnacleresearch.com. Dr. Duncker, thank you so much.
It's been my pleasure. Thank you for having me.